When we first decided to put this event together, I had met with one of our biggest reps, which is from Restylane, and she loves to be involved helping us in any way that she can, and so we started talking about some ideas.
It's working.
Yeah, the deep breaths are more therapeutic than diagnostics. So.
I'm Shelley Freed. I am the office manager of Freed Plastic Surgery as well as the spa director at Vibrance Medical Spa.
Oh.
Because the complications are really, really low.
And so after she left my office, I started thinking about it, and I started to get real excited, and I called every rep that we have, walked around the office, talked to the different physicians and therapists and all the rest to see what they would be willing to donate.
Can you think of particular questions or concerns you have overall?
I just was wondering, how soon can you read again, see again?
The entire process kind of took off from there.
Well, my name is Jonathan Freed. I'm a plastic surgeon in Auburn, California.
We found a patient that we had interviewed that we knew previously that would be comfortable with presenting to the public what she had done through our facility.
Upper lid complications are really rare. I tell my patients it's probably the only surgery that I do that I will ever have myself.
Oh.
She first came to us probably a couple years ago and talked to Dr. Freed about her eyes.
She's noted that her eyes kind of bulge. They look older and more aged than what she wished they did. She has noticed this ever since she was a child, and it's been something that's been on her mind for a number of years. So we were looking forward to helping her get an improved appearance by doing an upper-lower blepharoplasty. Basically, that involves removing the skin, excess muscle, and some of the bulging fat from a couple of different compartments in the upper and lower eyelids.
So I called Joanne to see if she would be willing to, and she broke down and started crying and said, "Why would you choose me?" And of course, first of all, thought maybe she had a lot of things to work on, and I said, "No, you're no different than anybody else, but you're a special person that we've known and have been interested in having eye surgery, and hear me out and see if this is something you want to do."
Generally, we go over some of the costs with them and explain to them the cost structure of how this procedure is done.
So she called back the next day and said she would do it, and was just so excited and very nervous about the process, knowing that there was a lot of things that we're going to be doing to her.
They booked the surgery, and we set up a consultation with them with our staff where they'll go over the pre and post-operative care.
We decided to narrow this event down to just the face, and so that's why we called it Focus on the Face.
I meet with them about a week before surgery as well, and during that meeting I review the surgical plan again, some of the risks involved in surgery.
Started off with her skincare, and Obagi is a phenomenal skincare line that does probably the biggest transformation of any of the skincare lines that we're aware of.
What the Obagi line does is it actually transforms the skin to make it look more refreshed and clean and bright. They actually have a saying from Obagi called the Obagi Glow. So what this skincare line does is it literally helps stimulate the collagen.
I then meet them next the morning of surgery. Now they're arriving at our operating room about an hour prior to the operation. The nurses interview them, they put an IV in, they go over what to expect that day of surgery. Our anesthesiologist will visit with them and review some of the anesthetic risks and some of the things to expect anesthesia-wise, answer their questions. Then I'll do my drawings on them just before surgery. At those drawings, I try to mark out where the excessive skin is. I want to make sure we don't take away too much skin so they can't close their eye, but we also want to make sure we take away enough skin so that they get the optimal result cosmetically.
Then shortly after that, we got her into her surgery for her eyelids, for upper and lower eyelids, as well as Dr. Freed did chin liposuction.
We then go into their operating room, we perform the surgery like I described. They wake up and get taken to recovery.
She had teeth whitening with Dr. Dunn.
The photographs show that her teeth are slightly darker than we expect or even anticipate in this day and age of chemical whitening of teeth. But she also did not want to be so white that it was obvious that the teeth were bleached so that everyone looks at them instead of the rest of her personality. So we chose, just by the length of the time of whitening, and Joanne chose a method and I chose a method for her that involved a custom tray that fits her teeth, and she places a gel in it and wears the teeth for an extended period of time. When she feels happy with the color, we stop bleaching. Then we evaluate it and make sure that there's no change in the color back to a darker shade, which can take place with certain bleachings. And Joanne has chosen this color, and it's very attractive on her. Whiter than her teeth were, but yet not quite so white that it's very noticeable.
And then we injected Botox and Restylane.
For Joanne, what I did was a little Botox and a little bit of dermal filler. I provided her with 36 units of Botox between the eyebrows and to the crow's feet area. And then also I did 2 syringes of dermal filler, 1 of Perlane to the lines between the nose and the mouth, and also 1 syringe of Restylane, which was also to that area, as well as to the marionette lines, what we call them, which are the lines alongside the mouth on the chin.
By about a month after surgery, most people look good enough that they're ready to go to a wedding or a big function, something that they're wanting to look their best at.
She went over to the Division Salon and had hair extensions. She started off with really short hair and now has shoulder-length hair. Had hair extensions, as well as they did her nails.
First doing a color touch-up on her hair, and then we're going through and doing a foil highlighting, which we have in process right now. And once we get that process done, then we'll go ahead and rinse her out, bring her back, and prep her for hair extensions.
It has the little bonds that I talked about earlier. This is a protein keratin bond, and this is actually what attaches to the little strands of hair, the little sections. So this is how it looks before we put it in.
I think that Joanne's result was good. She has a reduction in her upper eyelid skin excess. She has a nice reduction in her lower eyelid skin and fat bulging.
Would we do this again? Absolutely. It's been fun. In fact, we had a lot of reps recommending that we have media involved in this.
She has a little bit further to go as far as getting some more edema reduction.
And we decided just to have fun with this, make it low-key right now, but it's been a joy to do this for her, and the different companies have also had fun with this, so yeah, I'd absolutely do it again.
But overall, for the 2-month post-operative visit back, she looks pretty good. I'm happy.
Our biggest question is, how do we choose her, and can I be the next person? And we don't know when we're going to do this again or how we're going to do this, but we've had fun.
I am truly blessed to have known you and to have been a part of this transformation. I actually didn't between the brows, which is probably the most popular area.
great things, so I guess ladies want to ask me anything, you're welcome to.
Just working with everybody, they have been so friendly and helpful.